to invite our next speaker, which is Mr. Sadanand Toraskar ji, bringing 25 years of experience to the forefront. He holds an MBA in supply chain management from Wellinger Institute of Management and a strong educational foundation from Narsi Monji College of Mumbai. Including in MCOM and BCom, his expertise is broadened by postgraduate diplomas in hospital and healthcare management, export import management, and materials management, and a diploma in computer applications. He has worked with hospitals like Lilavati, Safi, Walcott, Seven Hills, PD Hinduja, and presently working with Dr. L.H. Iranandi Hospital. So, may I please request you to begin with the presentation?
Thanks to Mr. Vinod Kumar, Dr. Suvin Shetty, and whole of Kaho management team who has given me this opportunity to share my knowledge and expertise on today's platform. So today my topic is circular economy thinking in healthcare supply chain management towards sustainability, cost-effective and responsible healthcare. On the onset, also I would like to share that in healthcare it is still in very primitive stage of circular economy. So what does circular economy means? The circular economy is a transformative model that aims to move away from the traditional linear make and dispose approach and create a regenerative system in the context of a supply chain management. This means designing out waste and pollution, keeping products and materials in circulation at the highest value, and regenerating natural systems. This is done by eliminating waste and pollution. This involves designing products and processes that minimize waste generation from the outsides. It's about seeking waste as a design flaw rather than an unavoidable byproduct. Circular products and materials at their highest value, like keeping products and functions for a longer, using a product again for its original purpose, restoring a used product to a good condition, disassembling a product and rebuilding it using both new and used parts, processing material to be used in a new product, often considered a last resort when other options are exhausted. So this is a pictorial presentation how circular economy works. Then key aspects of circular healthcare supply chain management in India in healthcare is resource optimization. This can be done by implementing waste reduction and management, implementing strategies to minimize waste at the source, followed by a proper segregation, recycling, and safe disposal of medical waste. Product life cycle management, extending the lifespan of medical devices and equipment through repair, refurbishment, and remanufacturing rather than simply discard them. Next, sustainable procurement, which means sourcing environmentally friendly and ethically produced medical products and supplies, prioritizing suppliers' commitment to circular economy principles. Stakeholders and collaborations, encouraging collaborations and knowledge sharing among healthcare providers, suppliers, waste management company, and regulatory bodies to improve circular practices effectively. Adoption of technology, which means leveraging technologies to improve efficiency in medical device manufacturing, recycling processes, and waste management systems. And the last is policy and regulatory support, developing and encouraging policies that incentivize circular economy practices in healthcare, such as tax rebates for green initiative and clear guidelines for waste management. So here is again pictorial presentation how supply chain circular economy works from production to supply chain, consumption, reuse and repair and recycle. So in production, disassembling a product and rebuilding the same with the reused parts can stop our environment to become damaged with dumping of the used material. Supply chain eliminates waste and pollution and consumption of extending the lifespan of a product. We can help to enhance the lifespan of the product. Reuse and repair, use medical devices and tools. Even the linen material can be used to the fullest extent so that we can stop harming our environment. Recycle the packaging materials or the plastic items, even the metal products which are used for a product packaging can be reused or recycled so that we can have a green system. So next is challenges for implementing a circular healthcare in supply chain in India. Lack of awareness and infrastructure, limited awareness about circular economy principles and inadequate infrastructure for waste segregation and recycling pose significant challenges. Regulatory hurdles, complex regulations related to medical waste disposal and product life cycle management can hinder the adoption of circular practices. Cost and investment. Implementing circular economy initiatives may require upfront investment in new technologies and infrastructure, which can be a barrier for some healthcare facilities. Resistance to change. Healthcare professions and institutions may be resistant to adopt new practices and processes that deviate from the traditional linear models. As I said initially, it is still in a primitive stage in healthcare for a circular economy. Yes, it is most common in corporate sectors, but in healthcare, it is still in primitive stages. So this is how transformation of healthcare system by technology in circular economy. So advanced analytics by implementing AI and machine learning algorithms that analyzes historical use, seasonal trends, disease patterns, social determinants of health, and even real-time data from electronic health records. This leads to far more accurate demand predictions, minimize overstocking. Also, deployment of IoT sensors, RFIDs, real-time location systems to track medical supplies. This provides unprecedented visibility into inventory levels, locations, usage, enabling automated or reordering, reduce loss, theft, optimize storage, and minimize expired products. So opportunities. So opportunities for circular healthcare supply chain in India is like economic growth. A circular economy can create new business opportunities in areas like recycling, remanufacturing, and waste management, boosting economic growth. Environmental sustainability by reducing waste and promoting resource efficiency. A circular economy can help mitigate the environmental impact of the healthcare sector. Again, social equity. Circular economy initiatives can create jobs and improve access to healthcare services, particularly in underserved communities. Public health benefits, proper waste management and resource optimization can lead to improved public health outcomes by reducing the spread of infections and promoting a cleaner environment. So these are the 8 R's, how circular economy for healthcare works, like redesign, repurpose, recover, repair, refurbish, reduce, recycle, and refuse. By implementing all these practices, we can successfully have circular economy for healthcare sector. So next is benefit of circular economy in supply chain for healthcare. Cost saving by reusing materials, recycling products, and reducing waste. Companies can significantly lower production cost and reduce reliance on expensive virgin resources. Increase resilience. A circular economy reduces dependency on infinite resources, making supply chain less vulnerable to fluctuations in supply chain prices and better equipped to adapt to disruptions. Reduce environmental impact. This is a primary driver. Circularity significantly lowers carbon emissions, minimizes waste sent to landfills, and promotes the usage of renewable resources, contributing to climate change mitigations and resource conversations, conservations. Innovation and new business models. The circular economy encourages the development of innovative models like product as a service, where customers has to pay for use of the product, not its ownership. sharing platforms, and robust recovery and recycling initiatives. This can create new revenue streams. So steps to implement: audit current waste and supply chain processes. The healthcare organizations can audit their current waste management and supply chain processes to implement circular economy in their own institute. It may be in a smaller scale, but definitely they can start the same, identify reusable and recyclable items and can be put into the use. Collaborate with the circular friendly vendors, the vendors who are giving green products or who are having green product licenses, they can be introduced in your system. Train staff on segregation and reprocessing. Monitor KPIs like waste volume, percentage of reuse, and cost saving. So again, this is a circular economy which is most commonly adopted. It starts from production and purchasing to consumption and use and collection and processing. So it starts from designing a better products, reduce process waste, optimize life cycle through alternative consumption, promote reuse, improve collection, encourage recycling, invest in infrastructure, and develop markets for the recycled material. So the conclusion is circular economy in healthcare has a potential, but a circular economy in healthcare system in India has the potential to transform the sector, making it more sustainable, efficient, and resilient. While challenges exist, the opportunities for economic, environmental, and social benefits are significant, making it crucial for stakeholders to embrace circular principles and work towards a more sustainable future for healthcare. So that is the end of my presentation. This is my details. So anyone has any questions regarding circular economy in healthcare, they can reach out to me on my phone number or can send a mail to me. Thank you.